Hello, parents and students. My name is Kevin Cordes. I'm the superintendent of the Muroc Joint Unified School District, and it is a pleasure to meet with you again this week. I want to thank everyone for sending in their comments again this week, and I'd like to speak to a couple of items. First, a little historical background, because we're getting a lot more questions are coming in throughout the week and also in the surveys about coming back to school. When might that happen, and what would the conditions look like? And we are happy to talk about those in specifics as we get answers. And we're getting very close to being able to give you those. There's a lot of teamwork going on, a lot of discussion, a lot of planning that's happening behind the scenes. And I'd hate to get out in front of anything and misquote myself. But I just want to talk through a couple of things that we are seeing as a district. So for those that were here last year and saw this occur, when we were in the month of March last year of 2020, we were within a couple of weeks, everything went from life as normal to hearing something about COVID-19, understanding that it was a reality in the world. And then as far as schools went, within just a couple of weeks, we went from being completely open, life as normal, to the governor shutting down all schools and saying that schools needed to be closed down. There were even a couple of holdouts that were highly pressured and were in the news quite a bit. But essentially, up and down the state, nearly every single school and school district closed right at about the same time. Within just a week or two of one another, everyone was down. Now, coming back to school, we see something completely different. So when we discovered COVID, we had state leadership that said this is the way it's going to be for students in California, made a very quick and decisive decision, and it applied to all. In coming back, it has been left up to individual districts. Rules have been changed. I've talked about this quite a bit in other videos. I won't belabor that point. But the concept of being open again is very different for every single school district. And the term open is being used quite a bit by people, not to say anything disparaging about other school districts or what other people are saying. But the term open doesn't necessarily mean what we might think open means. So I just want to clarify that. We technically could make a claim that we are open. We've had a special day class back now for several weeks. With special education students. We are on the precipice of opening up a couple more special education classes that serve some of our lowest grade populations at both elementary schools. Some districts, when they say they're open, they mean that they're open for certain grade levels. Not every school district serves high school and middle school and elementary schools like we do. Some are just elementaries, or some are just high school districts. So for them to say that they are open, it could mean maybe they're open because they have they have every student in a particular grade level back. Maybe it means that they have a couple of classes open at each of their lower grade levels. It can mean so many different things, but the term "we are open" can mean so much and just means so many different things to so many different people. And so we try to be very careful. I try to be very careful about what we say and how we say what we're doing. I like to just stick to the actual facts of what we're doing. So we have been open for special education students who are the most severe, and we are preparing to open up special education classes, 2 of them, 1 at each elementary school for our youngest populations, and also for those students in those classrooms that are at the most critical need. Every week when we get feedback, the majority of feedback either talks about their appreciation for a teacher, our staff member. We get some comments about how there's too much screen time. We get some comments that we wish that there was more instruction, that there was less instruction. But by and large, kind of down the middle, it's just things are moving along, and we're a team, and we appreciate that, and we're making things work. And then there are some comments that come in that are very strong one way or the other. And those stronger feelings of people about whether it is, why aren't we back in school, or what are you doing thinking about coming back to school, are starting to creep up more. We're starting to hear some more of those. And I just would like to share with you a couple of things. One, I want to just reiterate that there is no definitive action being taken by state leadership that's saying that everyone can just come back. Not like when we went home. Not like when they closed school. They're not reopening them in the same way. They are using very different data metrics. Every county has a county health official that has a part to play in that. And yes, we all do play by a lot of the same rules, but we also play by some different ones as well. And so schools are making decisions for themselves based on what they feel is best. And there are a number of school districts who have opened, have come back, who have closed, have ping-ponged back and forth. And you can make arguments one way or another. I can see those that applaud people for doing the best they can and attempting to come back as quickly as they can. I understand those that say they have a problem with that and say those people should have waited until they were certain about being able to come back and stay back. So I'd like to read just two comments that came in this week. I really appreciate what everyone had to say, and I appreciate both of these perspectives. But I just want to read kind of where the things that we hear and the differences that we understand. We serve 1,700 students, and so when you count their parents and their guardians and those that take care of them, that's thousands of people that have opinions on this. And we respect each and every one of them. But I want to show you two different sides of the coin that we see. One of this first person, this parent says, why we aren't being given the option to have our kids go back to school despite, one, this district being given a green light to go back in the fall, two, the nationwide and statewide push to get all kids back in school, three, the overwhelming evidence from this entire school year around the country/world showing that elementary schools don't cause major outbreaks, four, teachers, students, and parents from, and they list their school, but I'm just going to say from our school, wanting to go back to school, and five, low COVID rates in the local community, much lower than other California schools who have already been back or are going back now. And then they state that many parents would appreciate a town hall on this. We do intend to have a town hall meeting where we discuss reopening plans as we get closer. I just want to make sure everyone knows that. And then, so that's kind of one side. Completely appreciate that. And thank you for sharing those sentiments and understand where you're coming from. And then this is from another parent. This is kind of the other side. And it says, forgive me, it says this. You all sound way too eager in these updates to get kids back in the classrooms lately. Nearly every federal agency is contradicting themselves and constantly changing their guidelines. I don't see why everyone would be so careful up until now and then just take their parachute off at a couple hundred yards from the ground. I would focus on maybe getting K through 1, maybe second grade, back by the end of the school year, more so as proof of concept to prepare for the next school year. Don't let the science deniers who've politicized this whole issue or the parents who can't stand to be around their own kids at home rush the process. Now, I know there are some very strong sentiments being said on both sides there, and I would just want to say I appreciate the passion that's coming from both parents, and we understand how you're feeling. Here's where we're at as a district. We're being asked, where do we stand and what are we planning to do? We are talking with our bargaining unit members right now, and we are talking about how we can bring more students back as soon as we can safely. Now, I've been saying that for months, and there are probably some people who are tired of hearing that. So if you want to hear specifics, I'm going to try to be very careful because I don't want to misquote myself. I don't want to be misunderstood, and I also don't want to get ahead of myself, because what we've adopted in Muroc is a team effort in this. We have included our teachers, our classified folks from the very beginning, and we try to be very collaborative in this. They are the people that work the closest with your children directly. And every time that we have opened up a classroom, the first person we've talked to is the teacher and those classified members who are going to work directly with your children. And so, that being said, if I were to look at my crystal ball and talk about what does the rest of this school year look like, I'll clarify that for you and talk about a couple things. For the parent that said we've been given the green light to open, in a way we have, and in a way we haven't. It isn't as clear-cut as saying that everybody's been told that they can just go back. What that means is there are a variety of methods that you can apply to the state to come back. For those that were here in the fall, you might remember that we were told that we could decouple from county metrics, meaning we could use local data and not depend on county data to decide how and when we would bring students back. And that's exactly what we did. From the time that we did that we decoupled, over the next several weeks, what we saw in Kern County was a spike in positive COVID cases like we had never seen before. We went from 9 per 100,000 cases as high as 85 per 100,000 cases in a matter of weeks. And so, as a district, what we did was we and we couldn't get vaccines at that point. There was no vaccines for educators at that point. There were no vaccines that were even being given out until very recently here for those that were 65 and over. It was for frontline healthcare workers. Totally understand that, support that they were the first ones to get those vaccines. But the process rolling those out to other people has not gone as quickly as we had ever hoped or that we were even told. So during this period of time from November into December, and as we got ready and we went into the holidays, our intent was we would come back at the beginning of January and we would start talking with our teachers and our classified about, okay, how do we safely start to bring these classes back? I've been saying to everyone, including those people, that we would come back as quickly and as safely as possible. One of those steps would be getting vaccinated for those that would like to, having a good sound plan, and also getting some clear definition on what it meant to have students come back. We had heard everything from coming back in small cohorts, how many people could be in those cohorts, meaning that at times we were hearing things like only 15 individuals per cohort, including adults, that you couldn't cross those cohorts at all. So how do you do high school if you're a high school teacher and you have 6 different periods or 5 different periods that you teach? And it seemed as if every other day there was more direction being given. 2 things were happening simultaneously. There was more pressure, it felt, from the state government and even at the national level to get kids back into school. Sounds great. For months and months, we were told, you can't come back, you need to stay away, it's very dangerous. And to the parent's point that was talking about pulling off the parachute at the last minute, it seems that very recently we have heard, just get back into school. On the other hand, we do want to, and we have been wanting to get kids back into school as soon as we possibly could. We saw that throughout the nation and throughout the world, there were other places that were successfully holding school. To say that everyone was is not true. There have been many places in the nation where there have been great disputes between a lot of people about coming back to school, and it hasn't been very smooth. But in many places, it has been smooth. So it has proven that you can do it. And we've been saying that all along as well, that it looks like you can do this. Why can't we put the right measures in place to be able to do it successfully? So from that time in November until January 15th, all we saw was an increase in case numbers in the state and in our county, and specifically in our county, and no opportunity at all for vaccines for anyone that would like those. Just now this week was the very first week that educators, those that were in the 1B category, were even offered vaccines in the state of California. And we've started to see people going and getting those that chose to do so. Our intent was to come back after the break and after the spike would come down. Everyone, health officials, and those that weren't in health, figured that there would be a spike in COVID cases after the holidays because families gather together, people travel more, and that's exactly what we saw. Our intent was to sit down, was to do and then do the necessary bargaining to actually have very specific plans put in place to bring the kids back. January 15th, the governor changed that. And he said, even for those of you that decoupled, unless you had brought back an entire grade level from the time that you decoupled until this January 15th date, you cannot be considered a school that can open whenever you want. You need to remain closed, and you'll have to find other methods like the cohort model where you can only have 15 people. There are a number of districts that were very upset about that. We were one of them. A lot of us complained. The governor made a change in that and said, all right, you can apply to go ahead and ask if you can come back. As we've looked at that, the criteria to do so meant that we would have needed to have sat down and negotiated and really had been on the precipice of bringing kids back at any moment except that January date changed our plans. Well, because the case rates were increasing so much, and because there were no vaccinations, we weren't going to sit down with everybody and ask them, hey, how do you feel about coming back to school when case rates are going through the roof like we've never seen, and there's no possibility of getting a vaccine? I think it would be rude at best. We knew that we could have that conversation, but up until that point, we were told we had all of the time needed to allow things to settle back down after the holidays, put the right plans in place, come to you as parents, present our plan, and start bringing students back, starting at the youngest grades. So now, where do we sit as of today, the 25th of February? There is another plan that's in place, another way that we can apply to be open. It isn't as easy as just saying that we get to come back. And that's what we are going to move forward on. Tomorrow I sit down with both presidents of the unions. We have a phenomenal relationship in the school district. If you look in the news, that is not the case in many. There have been some school districts that have had terrible relationships, don't seem to have respect for one another perhaps, or don't communicate very well. I am grateful that we care about students first and foremost in Muroc, and we do that collectively. All of us do. We respect one another as employees and as colleagues, and our first priority is to your children. Now, some of you may not agree with that or think that that's true because we haven't done what you were hoping that we would have done by now. And to you, all I can say is, I'm sorry that you feel that way, but that's not true. We really are putting your children first in every way that we possibly can. We're working with a very difficult state system to make all of this happen. Other school districts have been able to come back quicker than us because they did things differently. Some of them, maybe they forced their teachers to come back. Some of them, I can tell you for certain, didn't care if there was a vaccine option and sat down and also had other means to negotiate. Districts receive funding in very many different ways as well. Our school district, as we've talked about many times, does not receive the same funding as many other school districts. California prioritizes some students, and it has its reasons. I don't begrudge them for that or those particular students that fall into those categories, but we don't have a lot of those particular students. And so, compared to neighboring districts, we do not receive the same funding. And if our numbers were identical percentage-wise with the same type of students that are prioritized in California as even our neighboring districts, if we were to apply those dollars to our budget, we have about a $21 million operating budget. If we had the same statistical numbers as surrounding districts, we would have approximately $3 million more dollars to do things with. So we also have a budget that is very tight, and we do the very best that we can with it. We all work together to do the best for children. And so our intent moving forward is this. Thank you for those that have stuck around through this perhaps long-winded feeling response to you this week. But our intent is to be able to bring services back for special education students at a minimum, kindergarten through 6th grade by the end of the school year. My personal feeling is I would love to see that we can have our lowest grade levels be able to come back by the end of the school year if possible. I'd like to see transitional kindergarten, 1st and 2nd, maybe 3rd grade even get to come back. And as the one parent talked about, more than anything else, proving the concept, having an opportunity to come back into practice. We've been asked questions about what our safety protocols are. We have many, those are in place already for the students that are back. We have hand sanitizer for everywhere. We have ionization machines that are being put in every air conditioning system in the school district. It's the same technology that's used in hospitals. We use plastic barriers like you see in stores and restaurants and all throughout the nation now. We disinfect every surface and in the classrooms every single day. We disinfect throughout the day as needed. Keeping things clean and also wearing masks for our special education students that might have sensory issues. We even provide face shields so that we can ensure that there still is a covering there. But it's our intent that when the day comes, and we hope it's as soon as possibly can be, that your kids will come back to a safe environment. Now, we've also been asked, what about parents that don't want to have their kids come back? We know that moving forward, we're going to live in a world where some people possibly never want to bring their kids back to public education in the traditional sense. We are poised and ready to offer online learning for kids moving forward into the foreseeable future. What we don't know yet, and what we will be asking you soon, and we've asked some questions about how comfortable you feel about coming back, but we'll be asking more specific questions about how many of you actually want to come back and how many of you want to stay in distance learning. And we will staff appropriately and adequately, and we will do everything we can to make sure that we're supporting kids. Our goal is not to shortchange a child. It's to do everything we can to support them. That is why we came into this profession to begin with. That COVID-19 came along was nothing that we planned. I'm sorry that we're not medical experts. We have become much better at becoming medical experts than we ever thought we would. But at the end of the day, that isn't what we do for a living. We do a lot of reading. We do a lot of research. We listen to a lot of different people. But it is not as simple as when we close schools and somebody came in from a state level and said, there is some data, it's frightening, and at this point you will all close and you will all go into this direction. No one has come in and said, guess what, it's all over, everything is nice and calm now, and you will all come back and be open. We're getting some very conflicting information that's coming in. We do look at our local numbers. We try to do the best that we can. All I can say to you is thank you for your patience. If your patience are super low and you feel that we're not moving fast enough, know that we're doing everything that we can to move as quickly for you as we can. If you feel that we're moving too quickly, know that there will be plans in place for you, that you'll never be forced to do something that you're not comfortable with. And we will always be talking about options. Discussing options does not necessarily mean that that's what we'll get to do. And if I've been guilty of anything in the past, it's not talking about possibilities. Because I feel that as I say things, I want to make sure that what I say is heard correctly and that I don't misspeak and I don't misrepresent on accident. No one ever wants to hear, especially from the leader of any organization, that we don't know what we're going to do. We do have an idea of what we're going to do. What exactly, which plan we get to implement, we're not ready to quite share the specific details of, but know that it will keep your children safe, that it will benefit every child in the very best way that we possibly can, that we are working night and day on this, and thank you for all that you do. With that said, thank you for all the kind things that you have said about the staff again this week. That means a lot. We do try to share those with the staff. And again, I'd encourage you to share those directly with the staff members when you say nice things about them to us. I hope that you're sharing that with them. We hope you have a great weekend, a wonderful week ahead. We'll have more specific information for you in the very soon weeks coming up, I promise. Thank you, and have a wonderful evening.